Thank you all for joining us for this panel event on planetary health and OneHealth. My name is Catherine Bowen and I'm Deputy Director of Melbourne Climate Futures and Professor of Environment, Climate and Global Health at the University of Melbourne. I also co-convene with Dr. Belle Workman the Earth System Governance Planetary Health Justice Working Group, and it's my pleasure to facilitate today's event. It's customary in Australia to commence a formal event like this with an acknowledgement of country. So accordingly, I acknowledge the traditional owners of the unceded land on which we work, learn and live, the Wurundjeri, Woiwurrung and Bunurong peoples here in Melbourne. I also acknowledge and am grateful to the traditional owners, elders and knowledge holders of all Indigenous nations and clans who have been instrumental in the reconciliation journey. And I recognise the unique place held by Aboriginal and Torres Strait Islander peoples as the original owners and custodians of the lands and waterways across the Australian continent, with histories of continuous connection dating back more than 60,000 years. I also acknowledge their enduring cultural practices of caring for country, which is pertinent given the topic of today's event. I pay respect to elders past and present, and also acknowledge the importance of Indigenous knowledge in the Academy. As a community of researchers, teachers, professional staff and students, we are privileged to work and learn every day with Indigenous colleagues and partners. It's my pleasure to introduce two of my colleagues from the Earth System Governance Planetary Health Justice Working Group, who will provide an introduction to the two key concepts of today's panel event, OneHealth and planetary health. So these presentations will really present a great opportunity to demonstrate the complementarities and the distinctive ways in which these concepts have been developed and applied. So we will first hear from Assistant Professor Godfred Boating, Director of the Global and Environmental Health Lab, a Canada Research Chair in Global Health and Humanitarianism, and a Faculty Fellow at the Dardileh Institute for Global Health Research at York University. Godfred will be leaving the event shortly following his presentation, given the time of day in Canada. So do please post any questions into the chat during his presentation. So following Godfred's presentation, we'll hear from Professor Sharon Friel. Sharon is an Australian Research Council Laureate Fellow. She is a Professor of Health Equity and Director of the Australian Research Centre for Health Equity at the School of Regulation and Global Governance, or RegNet, at the Australian National University. She is a Fellow of the Academy of Social Sciences Australia and the Australian Academy of Health and Medical Sciences. So given your backgrounds and your multiple roles that you both hold, we're really grateful that you've been able to share with us your thoughts on this important topic today. So thank you both very much for attending. Over to you, Godfred.
I'd like to thank my fellow panelists for being here for us to discuss this very important topic on overcoming conceptual limitations to inform Earth system governance in an era of polycrisis. As you rightly heard, I'll be presenting on an introduction to OneHealth. And so this evening, we will examine how these concepts, particularly planetary health and OneHealth, have been developed. And in my case, with a focus on the history of OneHealth, its implications for governance and why we should care about OneHealth and its connection to planetary health. Does it matter its origin and its application? Does the distinction between OneHealth and planetary health make any difference for implementation and application? And does the intensification of natural hazards and the anthropogenic activities that drive climate change affect climate change and its effect on human and animal health important to look at? Is there a symbiotic relationship between these effects on human health, animal health, and the environment? If there is, then I argue that we must examine these interrelated concepts as parts of a whole. Indeed, from a systems perspective, the distinctions made on these two concepts may call for a separate programmatic and policy action. However, examining them as two related concepts with a common underlying driver or drivers will ensure proper governance systems in improving not only human and animal health, but the environment. These concepts can be described as part of a collective response to some of the complex and wicked problems facing our world today that transcend disciplines and borders, and I'm talking about country borders. So from my perspective, we will be advancing policies that at the end, though focus on One Health, do promote planetary health. And so right from the beginning, we note that planetary health and One Health are all intertwined. Recent disease outbreaks and the human health impacts of climate crisis and of ongoing ecological degradation around the globe have highlighted the salience of an interconnected approach to human health research and interventions. Indeed, increasing extreme weather events, growing food insecurity, and changing patterns of infectious diseases, as well as the human-animal and human ecological interface intensified by socioeconomic and cultural factors, such as domestication of animals, wildlife farming, and increased global mobility of goods and people, all point to the need for a One Health approach to improving health. Indeed, the polycrisis facing our world today begs the question, are the threats of planetary health threatening One Health? I want to paint a certain picture for you to see why it appears that One Health has become a predominant concept, which is being discussed in probably several disciplines and across several programmatic developments that have come up recently. So the increasing threat of infectious diseases around the globe brings our attention to issues on zoonotic diseases. In fact, 60% of emerging infectious diseases are from animals. Over 30 new human pathogens discovered in the last 30 years, 75% of them are from animals. And in the new era of infectious diseases, emergence and re-emergence, fast spread, abated by rapidly changing socioeconomic factors, all point to something related to One Health, the human, animal, environmental health, as we see it today, and for some years have typically been studied and addressed in silos. Hence, the notion of bringing them together to be looked at as a holistic concept. So the emerging disease threats we imagine would only worsen in the face of increasing anthropogenic activities that drive climate change with cascading effects on other forms of emerging diseases. In the face of threats to planetary health, it is my position that the environment, human health, and animal health is threatened, and the diseases you see on the screen point to what we've been dealing with more recently, which calls for a very deep detail into One Health. So these, I ask here, what factors mediate disease spread? You can look at the viral factors, the human factors, ecological factors. But these factors all have driven the surge in zoonotic infectious diseases. And these have been associated with the cascading effects of climate change. And I'm sure my colleague will go deeper into the issues as they pertain to planetary health. But with a focus on One Health, we want to see, how did it all begin? How did this all begin? So an examination of the historical antecedents leading to One Health suggests that human medicine has a rich history of engagement with animals, their diseases, and the people and institutions dedicated to animal health. A number of factors have played a role in this journey. Thus, though this presentation might seem to show a linear progression, it is not linear at all. But for the time we have, I'd like to examine the origin of One Health from 3 different eras: the pre-modern era, the veterinary era, as I'll put it, and the integration of animal and human medicine in the 20th century and its surge in the 21st century. I must say that the historical links between the health of humans, animals, and the environment are multiple and they are profound. We cannot look at all the links, neither can we focus solely on historical figures. Thus, in the pre-modern era, drawing from literature from several writers, we note that animals played a crucial role in medical research due to their presence in everyday life, making them easily accessible for experimentation. In fact, researchers studied a wide variety of animals, earthworms, frogs, horses, and more, through comparative research that sought to establish general truths by examining species similarities and differences. In fact, having been influenced by evolutionary theories, they believed in species-specific findings unless proven across multiple species. In fact, figures like Aristotle, Galen, Vesalius, and Harvey advanced comparative anatomy, linking human and animal health. The dominant medical theory of the time, humorism, further connected their treatment approaches, while later figures like John Hunter and Edward Jenner solidified the connections between animal and human medicine, paving way for today's integrated One Health approach. Now, in this slide, I provide a timeline of the development of One Health. The foundation of One Health, which integrates animal and human health, can be traced again to the pre-modern era. So from ancient civilizations before Christ, 3000 before Common Era, particularly in ancient Egypt, Greece, and Rome, saw animals as central to healing rituals and early medical practices. Indeed, figures like Hippocrates and Galen used dissections to study anatomy, laying the groundwork for later medical knowledge. Then you move on to the medieval period, 500 to 1500 Common Era. Medical practices were influenced by natural philosophy and religion. Animals were used in surgeries and treatments such as leech therapy, though dissections were limited due to religious constraints. Then move on to the Renaissance, 1400 to 1700, a revival of dissection and comparative anatomy, which marked that period. Then to the Enlightenment, 1700 to 1800, Common Era, where empirical research became key with animal dissections and vivisections commonly used to study human anatomy. Then the 19th century, where animals were abundant and used extensively in medical research. In fact, comparative medicine explores similarities between species with figures like John Hunter and Edward Jenner using animal studies to improve human health. And so through these key milestones, we can see that long before One Health was a formal concept, the relationships between animal and human health were already evident and growing. These early connections laid the groundwork for a more holistic understanding of health and disease. In fact, the acceptance of the germs as causal agents in the 20th century diverted attention away from the environmental factors that influence the emergence, spread, and clinical impacts of diseases. This increased development of vaccines and antibiotics, but would find later on that the environment then got to be focused on. A bit about the 20th century, when it came to veterinary medicine, the formal establishment of veterinary schools in Europe marked a significant milestone, but animal medicine had long attracted the attention of doctors. In fact, in the 19th century, medical professionals continued collaborating with veterinarians, advancing comparative medicine through investigations of diseases like anthrax and rabies, particularly in the advent of the germ theory and Darwinism. However, we find that competition arose as veterinarian surgeons felt doctors were encroaching on their field, right? So at least this gives you a sense of how things were, even from the 19th to the 20th century. But then in the 20th century, the relationship between animals and humans in medicine evolved significantly. Medical research initially utilized a variety of animal species, emphasizing their diversity. However, urbanization led to a shift towards standardized laboratory animals for research in cancer, genetics, and drug testing, treating them increasingly as models for human biology. And so by the mid-20th century, the idea of one medicine emerged, promoting an integrated approach to human and animal health, supported by organizations like the WHO, the FAO, and the Rockefeller Foundation. These collaborative efforts laid the groundwork for the contemporary One Health movement, highlighting the interconnectedness of human, animal, and environmental health. And so today, when you talk of One Health, it has been examined as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. As an organizing concept, it has proved flexible enough to encompass very different language, ideas, and working practices. It has been coherent enough to enable communication across disciplinary and organizational divides. As an elastic concept, it has called for a transdisciplinary approach to research in improving human health, animal health, and the environment, taking together, I dare say, improving planetary health. However, there are still questions about how it can be used to engage in discussions on colonial and post-colonial legacies, and most likely neo-colonial approaches to health. How does the concept drive ongoing tensions between local and global approaches to health? I am sure we'd have some time to discuss this. But for its implications for governance, the World Health Organization has established the One Health Initiative to advance insights on human, animal, and environmental health. It established the One Health tripartite, which includes the WHO, FAO, and the World Organization for Animal Health. It has established the One Health quadripartite composed of the Food and Agriculture Organization, UNEP, That's the United Nations Environment Programme and the World Organization for Animal Health. However, the quadripartite Joint Plan of Action points out that while the One Health concept has gained currency in global health practice, it is not being well defined or integrated effectively into the development of One Health programs, interventions, and legislative frameworks. This is echoed in the G20's Lombok Health Policy Brief, which identifies silos between research and implementing institutions as a significant barrier for generating, testing, and implementing human healthcare solutions that sustain long-term change. The question is, would these challenges be similar to what we find in planetary health? In fact, some of the key governance challenges as I've identified by this group. One, when you think of the lack of an integrated One Health surveillance system, in fact, countries lack the capacity to implement activities across 3 dimensions of the One Health concept, leading to limited monitoring and surveillance, particularly in the global south. 2, effective monitoring and evaluation of information on humans, the environment, and animals have been curtailed by a narrow focus on animal health, poor data sharing, and unclear governance structures around responsibilities for developing and administering One Health programming. In fact, in the absence of robust monitoring and evaluation systems undergirded by strong collaboration, well-defined legal frameworks, and well-delineated duty sharing, One Health cannot be effectively operationalized with the final goal of improving human health and health outcomes. The question is, would we see the same with planetary health? Understanding how One Health systems function to create human health impact is central in defining interventions that can improve human health, animal health, and the environment. And so in addressing some of these concerns, we see a number of organizations globally and within the Canadian setting that have come up. I lead the Canadian African Central American Network for One Health Monitoring and Evaluation. But that's for another day. But as I conclude, I am left with a lot more questions than answers. And some of the questions, as I stipulate on the screen, one, are the challenges facing One Health the same for planetary health? Does a threat to One Health suggest a threat to planetary health? Are the governance challenges of One Health the same or similar to planetary health? How different is planetary health from One Health, eco-health, and to some extent, population health? Is there a duplication of governmental efforts with a separate focus on One Health and planetary health? Are academics rehashing existing concepts, indigenous knowledge of One Health in a new nomenclature, planetary health? Would we benefit from addressing both here, One Health and planetary health, in an integrated fashion as a common threat to humanity? I hope this will spur up our discussions, and hopefully we leave this meeting having engaged on the concepts and how they could be looked at as parts of a whole. Thank you, and I'd like to acknowledge some of my funding organizations.
Thank you so much, Godfred. That was such a comprehensive and insightful presentation, and quite provocative with your questions at the end. And if I can be provocative, I think the final question is actually one that I think is critical to the work that we do, because as you said in your presentation, we are very good at working on our own fields. But that last point around, well, if we did put together these concepts, does that take us somewhere towards appropriate and effective governance to deal with all the common challenges that we have? So I think it's a fantastic segue now to Sharon's presentation. And again, I'd like to welcome Professor Sharon Friel. And I think you've just played such a crucial role in this field over the last many years, and particularly now with your leadership of the Planetary Health Equity Hothouse at the Australian National University. And I neglected to mention too that your laureate fellowship through the Australian Research Council, for those who aren't aware, it's the highest fellowship that can be awarded in Australia. So it's a recognition of the importance of this work as well. So I'll welcome Sharon and look forward to your presentation on planetary health. And please, actually, what I have forgotten to do is check if we have any questions for Godfred. So sorry, Sharon, we might just take a pause before we do launch in and see whether there are any questions. Godfred, you're back. Good. Have there been any questions? No, none yet. I'll leave it. We've got maybe a minute or two. If anyone does have a question, please feel free to pop it in the chat.
Can I ask Godfred just about his questions that you posed? You're not getting out of it, Godfred. You've got to help us answer those questions because you won't be there in the panel. But do you have a sense of what would be a good way forward so that we don't just keep reinforcing silos? If you think we do reinforce the silos, what would be a way forward?
Sure. Thank you so much, Sharon, for the question. One, I have a different perspective. Like I had said, I do see planetary health and OneHealth as parts of a whole. And so in addressing some of the challenges, I rather would push for an integrated approach where whatever programs are being set up is directed towards addressing the key issues or the fundamental issues that underpin the challenges driving planetary health and OneHealth. And so my emphasis and what I would suggest is look at things from a systems angle, a systems perspective, and identify some integrated approaches. Certainly treating them as silos would promote to some extent a specific focus on key issues. However, in fact, there are lots of times where looking at them from an integrated angle might be beneficial. But of course, that is my own assessment of the issue.
Thank you, Godfred, for that answer. I think it does demand a richer discussion, doesn't it, that question? We have a question in the chat too, just quickly before you go. There was interest for you to articulate, if possible, a bit more about how OneHealth is potentially a colonial approach and what do we need to be conscious about to avoid that? Is that something that you'd like to answer, Godfred?
I mean, thank you. It's good you bring that up. And probably I would connect it briefly to indigenous knowledge and how various aspects of it appears to be rehashed in some of the presentations of planetary health. Right, so that sometimes recognition is not given to some of the practices and knowledge that has preserved biodiversity in some places. And so you could see, maybe you could say for a fact that there's a colonial element in there, but I also know that steps are being taken to use a decolonized approach when it comes to planetary health in some spaces. So yes, while that element is evident in some of the work that's been done, I believe there are other scholars who are trying to drive this from a decolonized perspective. Yeah.
Thank you, Godfred. And again, a topic for a much richer discussion, but many thanks for those insights. There's another question in the chat, but I think we might leave that until after Sharon's presentation because it also relates to Sharon's as well. So thank you so much again, Godfred, and enjoy the rest of your evening in Canada. So now I will invite Sharon. Many thanks, Sharon.
Lovely, thanks, Catherine. And yeah, so pleased to be part of the discussion. Really amazing for the Earth System governance community to really embrace these deliberations. So really thank you for your leadership and with Belle and Gio for pushing this forward. Really excellent. I do also want to acknowledge that I'm coming to you from the Ngunnawal and Ngambri people's lands in Canberra in Australia, and pay respects to elders past and present. So yeah, so let me do the slide thing. So share that. Okay, yeah, you can see, good. Okay, so yes, so planetary health, and I actually want to position it in the context of planetary health equity in particular. So if we think of planetary health and planetary health equity as the equitable enjoyment of good health in a stable Earth system, I hope what that conveys is this interplay between human and non-human relationships. I think my motivation, and I think quite a significant part of the planetary health field, has been motivated from a human perspective primarily. It's been, why are we seeing the sorts of premature deaths for humans, the levels of morbidity and mortality among humans that could otherwise be avoided. And my motivation of bringing planetary health equity and bringing equity very strongly into the mix there is that there is no biological reason for that, and there's also no, it's very unfair and unequally distributed. We also know, certainly in the field of population health, of public health, when you start to talk about questions of human health, you have to talk about questions of politics. Health is incredibly political, and I'm going to come to that very significantly in a second. But I wanted to really just to tease out why I think this relationship between human and planetary health is fundamentally important. And we in the hothouse, the Planetary Health Equity hothouse here in Australia, we do focus explicitly on climate change, but I acknowledge and encourage people to make sure that planetary health is not just about climate change. It's just, that's what we happen to focus on. So climate change, absolutely locking in intergenerational inequities. So people today, people and animals today experiencing the effects of climate change, but because of the lock-in of climate change, populations who are not yet born will experience those effects. Climate change is also exacerbating existing economic inequities. And this is where, and that really matters for health. So we know that loss to livelihood, we know loss to national level GDP, regardless of what you think about GDP as a measure of anything. But we are seeing it being sensitive to pressures on economic growth from climate change, and particularly in countries in the global south, where economic, those economic inequities between countries are already very significant. And then, of course, climate change interacting with the already existing social inequities. So whether that's to do with our built environments, our working conditions, our housing, think about the inequities that exist within access to quality, affordable housing, for example, which we know already matters, or we already know matters for our human health and well-being. And then when climate change, with the thermal stresses, with the intense extreme weather events, will exacerbate the experience through these everyday living conditions to affect our physical and our mental well-being and health outcomes. So climate change is a massive amplifier of existing health conditions, physical and mental health, and will really amplify the already existing inequities in society, which will then go on to cause health inequities, physical and mental health inequities. And as Godfred was speaking, when you think about in the language of OneHealth, or particularly around zoonotic diseases, we're going to see the increase in some of those particular health conditions and the inequities of the distribution of those conditions. So both communicable and non-communicable diseases really matter when you think about some of these things that I have up on the screen. And I would argue, and this perhaps aligns with some of the remarks from Godfred around the integrated, the necessary integrated approach. We speak about this as the consumptogenic system, the web of institutions, of policies, of commercial activities, of institutional and social norms that are absolutely together, are absolutely have done and are continuing to incentivize and reward the excessive production, extraction, production and consumption of fossil fuel, carbon reliant goods and services, which of course are really bad for the earth system and which are unhealthy, bad for humans, and very unequally distributed. So we think about this, as I say, as this consumptogenic system, and it seems fundamentally important that we think about addressing these underlying common drivers of climate change, of inequalities in health. But I think we have to recognise the inequities built into the consumptogenic system. It's happening predominantly in rich countries, and it's happening predominantly among rich people. So action to address the consumptogenic system to improve planetary health equity for planetary health equity purposes is not a one-size-fits-all. We recognise that much of the harm is coming from the rich world, and much of the harm is taking place among rich communities. And the policy response, I'm very, very concerned about what has the policy response to date been. And really it's been focused at the individual level, it's been focused on servicing the harms that have already taken place. And you know, I'm not suggesting that that's not important, but it's completely insufficient. Wouldn't it be fantastic if we thought about moving forward, acting on the common drivers that relate to that consumptogenic system, because that would go a long way to improve concerns around climate change, to improve concerns about inequality, and to improve concerns about communicable and non-communicable diseases and their distribution. And that's a question of governance. So if contemporary governance is all about this interaction between the state, the market, and civil society, which that's what contemporary governance is looking like. It's not just about government action or international governmental organisations. It's the mixture of all of the different types of actors. But I would argue very strongly that the reasons that we see planetary health inequities is because there has been this much greater power imbalance skewing towards the interests of the market. And embedded in all of this are these inequities in the three I's, the inequities in the ideas, the interests, and the institutions. So let me tease this out just a little. If we have this consumptogenic system that is causing planetary health inequities, that is creating incredible stresses for human populations, for the Earth system, and for animal populations, when we put some of the remarks from Godfred into the mix as well. Then if we think about what are the dominant ideas, interests and institutions that are currently at play. So if ideas are all about deep core beliefs, the paradigms that shape how interests, what they mean. And I would argue, and the evidence shows us, that the dominant ideas that have been in place over the past number of decades have been colonialism, extractivism, that have been neoliberalism, so the shrinking of the state, the deregulation, the elevation of individualism, and it's been about market supremacy, the power of the market. So if these ideas, if these paradigms have been very dominant, what it does is it has allowed particular interests to come to the fore. So if you think about across societies globally, economic growth, and particularly unfettered economic growth, economic interests have been dominant, absolutely. We're here today concerned about planetary health or OneHealth, these interests about people, the planet, of animals. These interests have not been dominant in the public, the policy discourse. Economic interests have dominated, and also profits and profiteering have dominated. And then we also, aligning with all of this are institutions, the rules and the norms that enable ideas and interests to go forth and promulgate. So issues or institutions around free trade, the free market, of deregulatory environments, of financialization, and of, well, I'll speak about, particularly we see this at the moment, certainly in our academic environments, but it's across government, of new managerialism, of new public administration. So when we're thinking about how do we get these interests of planetary health, of OneHealth, to be elevated and to be concerned about, it's not a surprise that it's not been a dominant concern where the powers lie, because these are the powers that be. So how do we shift that? Then I would argue, from a governance perspective, in the different rooms at multiple levels, the idea of imagining and embedding a new paradigm, whether that's OneHealth, whether that's planetary health, we're going to really discuss that, I think, in the panel, but we have to help embed a new idea that elevates the interests that we are here concerned about. Imagine if public policy took that really seriously. What would public policy look like that optimises climate, environment, social health outcomes? Those multiple wins that we might be concerned about. Imagine market activity, and this, I think we've got a long way to go, where markets serve planetary health interests. This is the politics, this is the political economy of planetary health equity, getting the politics and economics to align in pursuit of planetary health and planetary health equity. And then releasing the influencers. How does civil society, how do academics from different disciplines, from different perspectives, bring to bear these new concerns? Well, they're not new concerns, but these concerns about planetary health, about OneHealth. How do we get that embedded? How do we mobilise strategically? So it's not about, oh, my issue is bigger than yours, my OneHealth issue or my planetary health issue is bigger than yours. It's about, we're here because we have a common shared interest that we want to get policy, we want to get market, we want to get community activity that's concerned about these common shared interests. These are questions of power. For us as academics, and I say us, I'm an academic, how do we bring fit for purpose evidence from, and different knowledges that can help shift an agenda towards these perhaps much more progressive shared concerns. I don't honestly care what it gets called, but language does matter, and I hope we're going to speak about that in the panel. I'm concerned about making sure that we have a global evidence base that gets framed in ways that shift a narrative, that gets in front of a whole variety of actors across different domains, where there is the power to advance politics, policy, market agendas that will help us achieve planetary health, OneHealth in an equitable way. So I hope that's a provocation for us for the panel discussion.
Thank you so much, Sharon. Always interesting and provocative to listen to. Many thanks. I was particularly taken by your comment around we need to get the politics and policy to align. And we say that, but it's such a fundamentally challenging area, isn't it, for us all? So whichever work, we're in, whether we're in universities, whether we're in public organisations or the private sector and beyond. So many thanks for that. Any questions for Sharon? While you think of your questions, we do have one from Nadine. Nadine Richings has popped in here, and she popped it into Godfred's presentation, but I do think it aligns to yours as well, Sharon. Nadine writes, I believe an effective approach to improve the planet for all requires an ecocentric or planet-centric approach rather than an anthropocentric perspective. Can you comment on this, please?
Yes, look, I don't think it's an either or. I think, I hope what some of my remarks were sort of highlighting was it's this really dynamic relationship. If we don't have a stable Earth system, then, and it continues to be degraded by humans. We've got to we recognise that. The risks, the challenges for people, for animals, multiple species, is really problematic. So absolutely having an ecocentric perspective is vital. Yeah. But to me, what the power of the I can't even say it sometimes, is it places the blame on humans, and we have been, and some of the human practices, not all of them, of course, some of the human practices, particularly in rich countries and particularly among rich populations, have been really problematic. So there's this dynamic relationship there. If we only think about humans, that's really problematic, of course. So I hope we think of them as being so integrated. Yeah, it's certainly the way I would think of it.
Yeah, thank you, Sharon. And a final question from Sam Netherclift. Thanks, Sharon. I'm wondering whether you could give us some examples of what market activity that serves planetary health interests looks like.
Like, I'm a complete optimist, sometimes sensibly so, and sometimes completely Pollyanna. But I take a bit of hope from seeing two things happen. So the sustainable business models that are developing, so things like cooperatives, things like social enterprises, that are building in much more of a discussion around stakeholder rather than shareholder. They're building in much more of a discussion about environmental, social considerations into their business models. Whether that's just at the fringes or not, time will tell. To me, it's a nose in the tent. It starts to create a rupture in the dominant business model. We also see the same with the ethical investors. That's a massive generational shift that's taking place there, which I really take great hope. You know, like, of course, the big investors are still saying, nope, invest in fossil fuels, invest in all these harmful industries, but there is a generational shift. So, you know, there's lots to be done with engaging with investors as well, where, again, a little nose in the tent for some shift happening. It's not there yet at all. We have to continue to monitor, we have to continue to hold them to account. And then also the development of a regulatory framework. So this is where government has to step in and incentivise. There's some gorgeous work happening through an Australian colleague, Christine Parker, looking at an ecological regulatory framework to help with some of those things. So there's little glimmers of hope, I think, within the market, within the business world. We just need to be much more, for those of us concerned about these sorts of issues, you helping hold them to account and then helping understand what other business models could or should look like.
Thank you, Sharon. And just to add on that too, there is a really good initiative called the Climate Pledge that's particularly focused on private industry, Sam. So if you had any interest in having a look into that, and there was also an interesting section on that in the podcast Outrage and Optimism, which I highly recommend for those joining the webinar if you haven't already become a listener. Thank you so much, Sharon. That was fantastic. So now we're going to, in the remaining amount of time that we have, given we've had such a comprehensive overview of these two concepts, we will now turn to our panel discussion with Sharon and with three experts working in diverse areas across planetary health and OneHealth. So you can see our panelists on the screen here. So on the far left, we have Associate Professor Nicole Redvers, who is a member of the Denenyu First Nation and has worked with Indigenous patients, scholars and communities around the globe her entire career. She is an Associate Professor in the Department of Epidemiology and Biostatistics and is a Western Research Chair and Director of Indigenous Planetary Health at the Schulich School of Medicine and Dentistry at Western University. She has been actively involved in regional, national and international levels, promoting the inclusion of Indigenous perspectives in both human and planetary health research and practice. So welcome, Nicole. Next, we have Dr. Rebecca Patrick, who is the academic convener of the climate change work here at the University of Melbourne, the Climate Catch Lab. And she sits in the Melbourne School of Population and Global Health and is a senior research fellow. She has broad-ranging expertise in climate change and public health research. She's been conducting a lot of policy-relevant work as well, in addition to her training and capacity building projects. And she's worked for international, regional, and national partners. Rebecca had a life before joining academia, and she was a practitioner in community, women's, and youth health services. So welcome, Rebecca. And we also have Geo. So Ms. Georgia Dalla Libera Matchiori, I hope that was all right. Geo is a health scientist by training and a systems thinker by passion. She previously worked in infection diseases research and with different NGOs in global health and sustainability. She's currently doing her PhD with Sharon at the Planetary Health Equity Hothouse at the ANU. And she's investigating health philanthropy's research agenda and its implications for the achievement of planetary health equity. So our panelists had some questions to reflect on. And so I'd like to start by inviting each of our panelists to provide a 5-minute introduction to their work by responding to the following 2 questions that you've had to think about. So the first one is, how are you engaging with these concepts, so One Health and planetary health, in your research and practice? And the second one is, what are your experiences with these concepts, and what's their capacity to pragmatically support the advancement of positive health outcomes for all, or health equity? So Nicole, if I can turn to you first, please, and also reminding attendees to post any questions in the chat, please. So welcome, Nicole.
Yeah, absolutely. Masi Cho, thank you. Appreciate the time, and thanks to the fellow panelists as well as the presentations for helping to set the context. And part and parcel, I think, with my perspectives on both One Health and or planetary health really needs to be situated in context, because over time, having worked within these spaces for a number of years, there's often, a perceived disciplinary conflict sometimes between fields of Western science and practice and policy. But what really needs to be clear is that the perceived differences between, such academic disciplinary concepts, whether it's One Health, planetary health, eco-health, or other kinds of things, have really been partially or fully conceptualized from a Eurocentric, Euro-Western-centric knowledge tradition. And arguably, those disciplinary conflicts are of very little value to us as Indigenous peoples. And one of the things I think that really is key is that, the conventional framings of both One Health and planetary health, as described, have really been born from Euro-Western centric academic traditions and worldviews. So when I first entered the space a number of years ago, particularly around the stages of when planetary health was starting to become a little bit more common conversation note in various circles, is recognizing some of the interesting dynamics between, One Health identifying planetary health as too human-centric, and then planetary health, noting to One Health as being too animal-centric, and these sort of interesting sort of conceptions, and both really, self-aligning to Indigenous knowledges in some ways because of the assumed, holistic view of both perspectives. And, in part and parcel with my look at these two systems, one of the things that I had noticed was that One Health tended to revert to very biomedical reductionistic sort of approaches at its origins. And in fact, Dr. Sean Hillier, who's an Indigenous scholar based at York University, in fact, the same university as Godfred, had done a number of reviews, including a systematic review published a few years ago, screening One Health, and found absolutely no inclusion of Indigenous traditional knowledges as part of the publication stream of history in there. And, when I had looked into planetary health, had noticed a few scholars starting to interact with the terms. And one of the things that I found interesting was, despite what I strongly believe is two conceptually important concepts that have important benefit in their own ways from some of the gross challenges that we face, I personally have gravitated more towards the use of planetary health for a few key reasons. Number one, it's very hard to translate the number one into Indigenous knowledges as a concept, where Mother Earth's health, Pachamama, whatever the translation is with Mother Earth's health in Indigenous languages is a very well understood concept in that, but also the part encompassing our Mother Earth's health as being inclusive of all systems, whether or not they're animal, whether or not they're human, whether or not they're ecosystem based, whether or not they're part of our economic trade systems, whether or not they're part of arts, culture, the rest of it. So the synergy of the translation became easier for me. I also found it easier to be able to push back on the lack of exclusion around Indigenous traditional knowledges within planetary health spaces than I have within OneHealth spaces, although that has improved in the last year or two, which is a very positive step, I think, in the right direction, particularly with the redefinition of OneHealth as of the last 18 months or so, when it became more inclusive of platforming the health of ecosystems. It's late here, so forgive me, I'm not as, my brain's not working as quickly here as it usually does. But ultimately, I think, as we move forward within these spaces, seeing Indigenous scholars start to interact with both OneHealth and planetary health, because I think both fields have understood, the past history of alignment with, what could be called ecocide, which is the killing of Indigenous knowledges as a part of Western science, and really the importance of recognition that there are other ways that are incredibly valid to solve and think about solutions-orientated ways forward through some of our greatest crises. So I'll just leave it at that for now, because I know we're going to have some discussions afterwards. Masi Cho, thank you.
Thank you so much, Nicole. And I'm really, really looking forward to the discussion, because you've brought up so many important points there. So many thanks, and especially for the time of day you're coming to us from as well, back in Canada. I'll pass on to Rebecca now. Rebecca, I invite you to share your experiences with these two concepts.
Thanks, Catherine. And I'd also like to acknowledge country and First Nations people and the land in which I'm engaging in this conversation today, and thank Nicole for identifying the key issues associated with Western-centric framings and the critical importance of inclusion of Indigenous knowledge systems. Like Catherine, very excited about the ensuing conversation and unpacking a little bit more what you've started there for us. So my first deep encounter with planetary health, so I'm coming at this from a planetary health perspective, was actually at a 2016 Eco Health Conference in Melbourne, and that was through my experience with working with other early career researchers, some of who might be online today. As we were kind of starting or continuing our journey through the field developments that were linking ecosystems, environments, and health in the Anthropocene. And as early career researchers, we had mentors from the senior academic community, and we were curious to understand how these fields, developments such as eco-health, planetary health, eco-health, also intersected with Indigenous knowledge systems over time. And so as a group, we got together following the conference and across online platforms to develop a thought leadership piece that actually mapped these field developments over time. And so what emerged was a community of practice of the various field developments over time. And I'm pleased to say that those relationships continue on and nurture and support me as a researcher and practitioner in planetary health. And the field of planetary health really resonated to me as a health promotion practitioner and researcher, because it shared understanding of complexity, systems thinking, human dependence on Earth systems for our own health and well-being, as well as health equity and justice. And that was my training from health promotion many, many moons ago. That also led over time to another thought leadership piece locally. The Medical Journal of Australia and Vic Health here in Victoria, Australia, commissioned myself along with Catherine and other colleagues locally for a piece around health promotion in the Anthropocene, and we use planetary health as a framing there. So in terms of planetary health became kind of a central frame for ongoing work. The question Catherine posed was around research and practice. So from thought leadership, finding my people over time and communities of practice, it came through in my work in climate change, nature and mental health promotion research. I found that the planetary health framing was really useful for working with students. It was a set of concepts that kind of packaged together a complex set of ideas, and for my students that I was working with, HDR students, master's students, honours students, they really got it, particularly if they were health promotion trained. And so my students over time have used the planetary health framing to try to underpin and understand their work in climate change mental health as it relates to young people. I've also used planetary health with practitioners working in the field, where we've been commissioned to evaluate and or design co-benefit interventions, one of which working with a local library who are very interested to do a planetary health project in the context of library work in local government settings. And so we helped that team of librarians understand what planetary health was, what the evidence was for planetary health, and translate that into an intervention in their local community. And then I'm just aware of time. Also, planetary health has been really useful in looking at indicators for planetary health work at a local scale. And we've done a little bit of work applying something called the Happy Planet Index in the Victorian system. And I want to acknowledge people like Trevor Hancock and other thought leaderships, that people that have hailed from Canada, Nicole, from your patch of the woods, that have helped me along the way in my planetary health journey. And just finally, Catherine, if you'll let me indulge, from the education and training perspective, planetary health has been something I've brought forward into scholarship of teaching and learning, helping us develop content to help people training in health understand that an understanding of environment and planetary health is actually core business for modern health professionals. So I've used the planetary health framing to upskill undergraduate and postgraduate students. I'll stop there and hopefully flag some other touch points in the ensuing discussion. Thanks, Catherine.
Thank you so much, Rebecca. Wonderful to hear that spectrum of work you've been involved with and those tangible examples. I'm sure you'll get some questions on those. So yeah, we'd love to hear more. Geo, please. Lovely to have you here.
Yeah, thank you, Catherine, and also well done in pronouncing my name. I know it can be tough. Yeah, so thinking about your question, the first thing that came into my mind was kind of really my journey through the use of these terms. As you said in the introduction, I come from infection diseases research. I was trained as a biomedical scientist. And so OneHealth was the term that I encountered before I encountered planetary health. And I think for some times in the past, I really thought that these two terms were kind of in conflict with each other or in competition with each other. But referring to your second question, I think what I came to acknowledge now in the work I do with Sharon, and in the last few years through my work in the NGO sector, is really to be very pragmatic in the use of those terms, and realizing that some of these terms work well in certain areas and some do not, and like how do we use them in a more pragmatic way to achieve what Sharon referred in her presentation, what we want, which is the achievement of good health for all on a stable planet. And so I think thinking back in my work when it comes to infectious diseases, I can see why OneHealth becomes a very powerful type of concept, and we see it with, for example, the antimicrobial resistance, how it's important to kind of have that perspective. But then for me, coming into work with planetary health equity has been kind of zooming out a bit and really kind of looking more at the broader picture and the broader connections, and really bringing in a way society. So like as a natural scientist by background, sometimes you come into social sciences and you're like, oh yeah, now things make sense, because you're bringing in things that are more related to the natural world with the human world, and how those connections come together, how things influence each other. And so for me, planetary health and planetary health equity more specifically have been a way to really look at things in a more holistic way, and try to understand the system, what Sharon explained in her presentation. And in my work, so I, as you said in the introduction, I focus on philanthropic organizations, which have been mentioned, for example, in the case of Gottfried's presentation, like Rockefeller Foundation was involved in the development of OneHealth, and several organizations in this space have been involved in OneHealth, but also in planetary health. However, has it been highlighted by some of the speakers, including Nicole, there is this kind of biomedical approach to health, and we see that in philanthropy as well. And so what I want to do with my work is really understanding this actor, which has quite a powerful position in global governance and in global governance for health. And so understand like how they can support and potentially not support, the achievement of this bigger goal of health for all in an equitable manner on a stable planet. And so I think like that's where planetary health equity is a more complex concept can really help me to unpack this. And I think when it comes to governance, which is what we probably will discuss a bit now, I think it will really help. But again, I want to be pragmatic and to come back to something that Nicole said and something that Rebecca said, which is going beyond academia and applying these concepts beyond the academic arena, and with different people, you realize that some of these terms don't work really well. Nicole mentioned, translating in the indigenous language, and coming not from I'm not an English speaker, and I can tell you that planetary health sometimes doesn't translate very well. Sometimes OneHealth doesn't translate very well in other languages. And it's also very difficult potentially to explain the terms in different, arenas. And so in my previous work, I worked with local governments, and in some places in Europe was easier to use the concept of OneHealth because it was easier to translate it. In other places, it was easier to use planetary health. So again, I think we have to be pragmatic of how this concept can be useful. We want to achieve the same thing, and how we can use in different arena with different people to achieve the same goal. And I will end it there and pass it on to you, Catherine.
Thank you so much, Gio. Again, wonderful reflections that I'm sure we'll delve into in the Q&A. Just after we hear from Sharon. Sharon, do you have any additional insights from your work involving these concepts?
No, nothing additional from what I've said, other than just sort of one reflection of, in that governance sense. And Gio sort of picked up on that question of, the sort of the pragmatism. And I do think, in terms of like, what is it that we are trying to achieve, whoever the we is, and maybe we talk about the we in a second, but that's a sort of the motivation for me. And if it helps speak about something in a particular way, to be able to get in the room to have those discussions, and then two, to help whoever's on the other side of the table, how does it align or connect with or help shift what they might be concerned about, that they as an individual or as an organization. Then I won't hang on to a language for the sake of the language. It's like, for what purpose is this kind of negotiation taking place, without letting go of our values or our, the kind of the core principles, and that's not always straightforward, of course, but I think, how do we navigate all of that? It'd be lovely to hear what folks think about that in the audience.
Thanks, Sharon. And I mean, that's an enormous question in of itself, in terms of how we navigate with our values and principles, because they're different wherever we are. So there's no sort of global universal set of values that we all ascribe to, although many of us would like that to be a certain set of values. But that's a really important point. And I think going back to what Gio said as well, Gio, you said it so softly, but it was so strong what you said around, we just need to bring in society when we discuss these issues. And when you do start to understand the social conditions and the governance elements of the world that we're all living and working in, as you said, that's when things start to make sense. So yeah, I think a really rich set of provocations from our panelists here today. It's been wonderful to set up a Q&A for the rest of the session. I think we have about a bit over 10 minutes now. So please pop any of your questions in the chat. I can see there's one here already. This is from an anonymous attendee. So stating that the WHO has been quite loud in promoting a One Health approach. Yes, that's definitely the case, particularly in the last couple of years. How can we make sure that powerful policy actors in the health space pick up on the best aspects of both concepts? So anyone like to start us off with that question? Have we seen this happen anywhere? Are there any good examples? Rebecca?
I think it's been in the Australian context, in the consultation leading up to Australia's first national strategy on health and climate. There was a lot of work across health professional and health organisations and medical peak bodies. And there were various submissions to government, both, written documentation, forums, presentations to Canberra, which is our, for those of you in Australia, that our political government centre. And in those submissions, OneHealth and Planetary Health came forward to inform the design of Australia's first national strategy on health and climate. So in the Australian context, with the incorporation of various actors across the health, environmental, planning systems, certainly those concepts have actually informed the development of national policy. I'd even put it on Catherine to say a couple of words on that as well, who's also been and Sharon, who've been instrumental to bringing forward those principles into our policy.
I'm happy to add a couple of thoughts on that. I think sort of more broadly, we see One Health more aligned with the thinking around health security. So it's much more closely linked to threats to our security particularly from an international perspective. And I think there are risks when we do consider that type of definition. So it tends to move us more to a defensive approach rather than a proactive and community engagement sort of type of approach that really listens to what might be priorities of different communities. So that doesn't necessarily link in with the strategy that you were talking about, Rebecca, but the strategy does talk about One Health and broader ways of framing environment, humans, and the world within which we live and the social constructs, absolutely. And importantly, it also has an international element to the strategy that does encourage us to look beyond and to see our important role in the region. But I'll pass on to other panelists to provide any comments on that as well. Nicole?
I can provide a few notes. I think, of course, the pandemic was a huge factor, with regards to the narratives and the approach with WHO, and really a lot of movement within the One Health space. We have started to see more of their climate and health committees now come forward in the last 18 months or so, which are integrating, in some cases, planetary health terminology as well as the UNEP in some of their work. In the North American context, we've seen a little bit more movement in the policy spaces, particularly around planetary health through the medical school initiatives that have been coming forward. There was a very successful movement last year with all the deans of the medical schools across Canada signing on to a planetary health declaration, which was fairly significant for all of the deans to sign on for their schools, which created a lot of leverage for conversations around some of the funding initiatives, and now a partnership with Health Canada, who's sort of our main health research and practice funder, but also in charge of the federal government's policy oversight with health, who jointly partnered with the group of medical school deans through the joint association here to create a roadmap for planetary health, which will hopefully be launched next year. So there are sort of spots of initiatives, but definitely from a Global South perspective, and frankly, with the COP coming up, not this year, but next year, likely we will see a large One Health movement with the Brazil COP coming for many factors as well, and a lot of conversations happening around how to bridge terminologies with regards to that scope, and potentially some political reasons around that. But there are dynamics that definitely are varying depending on the geopolitical space, but at the same time, WHO is starting to have some pockets within the organization that are talking a little bit more about the planetary health concept in the last year or so.
Yeah, thanks, Nicole. And I suppose just to pick up on Sharon's earlier point too, we do tend to think of planetary health quite exclusively around climate change, don't we? So, the importance of understanding that we're also talking about the biodiversity crisis. We're also talking about so many other things. It's really important that we think in a much broader perspective.
Can I also, just to add to the discussion about that, I wonder as well, is the One Health framing and perhaps dominant understanding, it's much less politically challenging, I think, than the planetary health. If you were to take, some of the big system arguments around planetary health, I think it's less politically challenging, and I think it's also been much more practitioner driven as well, whereas the planetary health has perhaps been, well, I think it is still so academic in many regards. And then, of course, we've got the two, so we've got the COP for climate change and COP for biodiversity, and so it splits the possibilities for the coherence of a term like planetary health, if that was something. But so I think there's I think there's a number of reasons why One Health is getting more air. But again, I don't particularly care, because I also see WHO is now finally talking about fossil fuels in relation to climate change, and that, that was a very deliberate move for WHO, where before they were talking about air pollution and sort of laying the groundwork to now feeling that they've got more of a supportive environment to start to talk about fossil fuels and fossil fuel industries. That's going to be great for planetary health. It's going to be great, who cares that it's under the rubric of just a language of fossil fuels. So, yeah.
Yeah, great points, Sharon. I think the WHO's manifesto for a green recovery post-COVID had a lot of attention on fossil fuels particularly, and I was really excited to see that piece. It's at least 2 years old now, but just maintaining that type of advocacy it was from the WHO. How do we as a community, I suppose, continue and support the WHO to take those sorts of stands against fossil fuel companies, for example? Gio, would you like to make a comment on any of this?
Yeah, I was just like just thinking about maybe a couple of things very quickly. One thing in terms of like the question, I think what I have seen in my previous work with local governments is really that it doesn't really matter what the term is. It definitely gives more power to local governments to adjust to a term if it's then promoted by big or international organizations that like WHO. But I have seen so many different terms that kind of lead all the same way, just used in different places. So I think definitely in at least at the lower level, so national level can be very difficult, but sometimes when you look at local and regional level governments trying to make some changes, the language started to be in there. And so I feel like, if it's OneHealth or it's Planetary Health or Eco Health, there's something coming, and I think that's very exciting. On the other side, I was thinking about the tokenistic use of words. And for me, OneHealth, I'm a bit scared of that because I feel that it's very easy to put in a document that we're going to take a OneHealth approach, but then what does it mean in practice? And I think that's always what I'm kind of waiting for when there are big announcements like the political commitment that was out of the last high-level meeting on antimicrobial resistance. Like, yeah, that there was OneHealth pitched in there, but what does it mean then in practice, and how are you gonna achieve things to reduce death due to antimicrobial resistance? That's always like what we have to look for, I guess, like to make sure that it's not just the use of a word that looks good on paper, but then in practice, what is actually happening. So that's just a reflection on that.
Thanks, Gio. And yeah, antimicrobial resistance is such a great example of the fundamental importance of societal decisions, isn't it? So yeah, that's a great example. I look forward to reading your work on that. We have a final comment or question for the panel, and then we'll be wrapping up. So this is from Nadine again. Thanks, Nadine. Thank you all for your insights and stories. Academic advocacy is critical in policy and politics. How do we get academic experts actively involved in politics and policy so their knowledge and understanding of planetary health can help create better Earth system governance? I think many of us are involved in policy, so in various guises. Perhaps fewer of us are involved in politics, but that I'd be keen to know. So I'll pass that question over to whoever would like to answer. Maybe each of you could, if you'd like, provide a brief answer and then any concluding statements, and then we'll finish up. Should I start, Nicole, with you at the top? You're the top right on my screen.
Yep, sure, absolutely. No, I think, we've sort of shied away for various reasons within academic places of getting involved. We've seen some very positive examples here in the Canadian context with couple of our Planetary Health folks deciding to run for politics, including Dr. Courtney Howard, who is running for the top of the Green Party there. We also have Samantha Green, which is actually currently running right now for a member of Parliament as well, who's been a strong advocate for planetary health for physicians and for the public as well. So, seeing these kinds of examples, I think really have given motivation to others about, reconsidering where our place is and our best service to society in given times. But ultimately, I think, for me, at least at this point, there is a lot of value in continuing the education motives, because, we see a lot of physicians, for example, being interested and excited at the topic, but not really knowing what to do. And, the more that we can provide platforms and opportunities, I think, and I always say, sometimes it's not about finding the solution, but opening spaces and creating spaces where solutions can be found. And that's easier sometimes to focus on, because it relieves the pressure of trying to find that one answer, but instead focusing on creating the spaces to allow those kinds of facilitations and the discussions to happen. And, we've really seen that here on this side of the pond, and excited to see where that goes in the next coming years, as more of our folks are starting to take the decision and running for political parties.
Interesting. Keep us updated, Nicole. And wonderful to have those reflections. And I think that particularly the spaces for solutions is something that many of us might take away with us from this today. Sharon, can I go next to you?
Yeah. So just a couple of thoughts. I was thinking of, for social scientists, within the Earth systems governance community, there are many, many social scientists. And I think one of across the social sciences, one of the key things that happens in there is understanding the conditions that lead to change. That's part of the scientific inquiry there. And bringing that to bear as an academic. And it sort of relates to the question of what's the purpose of research. I couldn't imagine anything worse than just doing research for the sake of doing research. It's research for a purpose. And whether that's feeding it to civil society groups, whether it's been part of social movements, whether it's we have a very deliberate strategy within the hothouse, and in fact we have a position called our government relations person, who literally goes and lobbies the politicians of at various levels, and to get us in the door to be able to bring the sorts of evidence that we generate to them. And then also, of course, with the public, being involved. Catherine, you mentioned the podcast outrage and optimism. Being involved in some of those public discussions. Sensitizing, raising awareness around a range of issues. So I think there's all sorts of opportunity for kind of academic activists or academic advocacy.
Thank you, Sharon. We've got you on record saying academic activists, so excellent. And Gio, please, a couple of final points from you.
Yeah, I kind of pick up from Sharon, basically. Yeah, I think for me, politics is everywhere. Like you can be naive and be like, oh, politics is just politicians doing politics, but we can all do politics. And for me, I consider myself an activist academic or academic activist, how you want to call it. For me, is about doing work that matters, that can bring positive change to society, but also bring that work and myself as a person, my individuality in other groups outside academia, without losing that connection to my work. But bringing and bridging the gap between sometimes academia and what happens outside. And so I think I really value people that have in many different ways engage with politics or advocacy, because I think that's where we bring our academic knowledge to the real world in different ways. And so I think that's actually very, very important. And there are different ways to do it. You don't have to go to marches to be an academic activist, but you can do a lot of other things where your science and what you're researching with your group can be brought, to the benefit of society.
Thank you, Gio. And there was a fantastic paper, it was probably 2021, written by climate scientists saying exactly this, that climate scientists must be activists. So I can't recall the first author off the top of my head, but if anyone can, pop it in the chat. And finally, Rebecca, some concluding points from you as we wrap up.
So the old adage, think globally, that's very much our role as an academic activist, practitioner and researcher and educator, but acting locally. I suppose for me, having relationships with my local politicians, MPs, councillors, is a really good way that I can share on a regular basis my science, provide that planetary health education, and actually feed in locally to policy and politics. And one example of that, I hark back to that national strategy. As a part of the campaigning leading to that national strategy, it was about actually all of us across, as health professionals and academics right across Australia, talking to our local MP about what we were concerned about, sharing the evidence about the link between climate and health, and doing that advocacy work in our local government areas. So that's one way I see the policy, politics and science that we produce having a really important place in the local sphere, where we can reach out to our neighbour who might be a politician. So thanks, Catherine, back to you.
Thank you, Rebecca. Yes, I think we're surrounded by them, politicians. So yeah, it's good always to speak up and speak loudly. And so many thanks. This panel has just been so interesting, so many wonderful perspectives. So I just really want to say a special thanks to all of our exceptional presenters and panelists for sharing your expertise and insights on these topics. If you have enjoyed today's session, please consider joining us again on Tuesday evening or Wednesday, depending on your time zone, for our working group's second ESG forum event, where we will introduce our draft 3-year roadmap and invite you to share your feedback and input in an interactive session. So many thanks again, and enjoy the rest of the forum. And again, an enormous thanks to our presenters and panelists today, Sharon, Nicole, Rebecca, and Gio, and a massive thanks to Belle and Gio and Blake for making this all happen. Many thanks.
Brilliant. Thanks. Bye, everyone.
Thank you.
Bye.